Now, President Trump, again, taking the fight right to the Democrats, stealing their thunder. Polls show that paying for health care is the #1 anxiety on voters' minds right now. The Democrats touting big government takeover of health care via Medicare for all. But the president now considering a bold new plan to let Medicare negotiate down drug prices. So has President Trump just again pulled the rug out from under the Democrats' midterm messaging? Joining me now, RNC spokesperson Kayleigh McEnany and Democrat strategist Jessica Ehrlich. Great to see you both tonight. Kayleigh,
good to see you.
Democrats are saying the Republicans have no plan to take care of pre-existing conditions. What do you say to that? And that the president's plan right now doesn't go far enough, Kayleigh?
No, this president has been unmistakably clear from the Republican primary debate stage that he would be taking care of those with pre-existing conditions. Nothing will change. The status quo changes for those with pre-existing conditions. What is different, however, is this president, as opposed to the last, is taking care of our seniors, taking care of American consumers, bringing down drug costs, because people don't quite understand we have a global freeloading issue going on where we pay a higher cost for drugs that other countries pay a lower cost for. And medication, for example, costs Medicare $1 billion here. If we paid what other countries pay, it'd be at $187 million. So we can't allow other countries to benefit off of our brilliance, off of our intelligence and our medicines. We have to equalize the playing field, and that's what this president is doing.
You know, Jessica, it sounds pretty good what Kayleigh just explained, and the president's plan sounds pretty good. Medicare Part B spending on drugs has doubled since 2006. The president's plan would cover drugs prescribed by doctors. It could save consumers more than $3 billion over a 5-year period, and the government more than $17 billion. It sounds pretty good, Jess.
It is. I mean, and hopefully it works. Unfortunately, right now, we don't know enough about all of the drugs that'll be covered. That'll still be up for debate. They believe it'll be mostly biologics. But unfortunately, Medicare Part B is a small portion of the overall Medicare spending. So whereas everyone wants to have their prescription drug costs come down, this will only affect a small portion of the overall millions of people we see across the United States, and particularly in the state of Florida, where their drug costs just have skyrocketed. And hopefully tying, as Kayleigh was explaining, that tying our costs more to those in Europe where medications are much less will help us and not hurt us. We just don't know exactly how that'll work out.
Kayleigh, Jessica just brought up Florida. The reports are out there. The Republicans fear a wipeout in Florida. I mean, losing it to progressive Democrats like an Andrew Gillum could ruin the president's 2020 re-election chances. A lot of Medicare recipients there. What's going on with Florida?
Yeah, there are 4.3 million Floridians, seniors, who utilize Medicare. And it's really important, Liz, you know, when Democrats say Medicare for all, that means Medicare for none. Just think of this in a common sense scenario. There are currently 56 million seniors nationwide on Medicare. If we add in the rest of the 270 million Americans into the pot, what happens to the Medicare for our seniors? It's reduced. It's watered down. Your benefits are gone. Medicare for all means Medicare for none. We see what's happening with Social Security already. So we've got to protect our seniors here in Florida. That means no socialized medicine.
And you see what's happening with the VA, Jess. I mean, Jessica, the Medicare for All plan is considered pretty incompetent. I mean, so much so that Colorado, Vermont, even California rejected Medicare for All. And when you say what it really is to voters, single payers, the approval rating for that plan goes south. And even, you know, even the Chinese don't have a plan of a complete government takeover. Chinese pay out of pocket 30% of their costs. What's with this insane, crazy Medicare for All idea coming out of the socialist wing of the Democrat Party?
Well, they want to move towards that and have more medicine and access to medicine for more people, so that we have.
But it wouldn't work that way,
healthier,
right? But it wouldn't work that way, right?
That is the plan. Is that
but
the more people who have more access
it doesn't work that way. That's a problem.
Well, no, that's actually the opposite. And unfortunately, what we're seeing, as Mitch McConnell said just a few weeks ago, that if we have a continuation of the GOP-controlled House and Senate, the next thing they're coming for are going to be what they call quote-unquote entitlements, which includes Medicare and Social Security.
Well, that is an important point.
I
hear what
you're
saying,
issues
Jess.
that we can't.
No, you're making an important point,
happen.
Jessica. What you just said about, you know, whether or not we need entitlement reform. That's been an issue that's been out there since the Reagan administration. Here's the thing, Kayleigh. Take on Medicare for All as single payer. Let's call it what it really is. Do the voters out there understand what single payer really is?
No, I don't think that they do. It means that everyone who has employer-based health care right now, more than 100 million, more than half the population, that means that goes away. It means the government, the same entity that runs the post office and Amtrak and all of these various services, starts to run your health care. It means we start to look like Canada. We start to look like the UK, where people have died on wait lists waiting for care. It does not work when the government takes over. Yes, we need to bring down the cost of health care, but the way to do it is not socialized medicine, because it's not working when you look across Europe.
Yeah, you don't really have it in the Scandinavian.
Jessica,
you don't really have it in the Scandinavian countries. They pay out of pocket too. They have privatized their healthcare system. You don't have guaranteed jobs or a minimum wage mandate in Scandinavia either. We get those ideas, but in theory they sound great, but in practice they're awful.
Well, really, part of the issue that we've had with the implementation of Obamacare is that the way that it increases the amount of money that's available to pay for these is by having, as one entity, not a complete, not doing away with employer health care, not doing away with the personal access where you can go and get your own health care, but where there is a single payer so that more and more people are in the system.
Yeah, I hear
so
what you're saying.
Is where that was part of the main issue.
Why rip everything apart and just throw the baby out with the bathwater? Why not just fix what we have?